Welcome to the 9 Health Fair and thank you for volunteering for the Pap smear screening. We're going to go over a few things today for you. You will have a kit of supplies. It will come in a box and everything you need to complete the Pap smear is in there. You will need to grab a few things from your site, such as a Pap smear screening table with stirrups, a gooseneck lamp. You'll need to have a sink available, a large wastebasket with liners. You will need markers, Sharpies, and paper to line the table. Your kit will come with requisition forms. You will need to have printed off copies of the Pap smear screening protocol as well as the guidelines so that the medical or non-medical volunteer can review these guidelines to determine if the female is eligible for the Pap smear. You do not have to make copies of that. You can simply put it in a plastic sleeve and have that person review with the participant. You do not want to have the participants pre-fill the requisitions in advance because they may decide not to have the screening, and one form goes with one Pap smear specimen container. The requisition form must be filled out, all highlighted areas. Date collected, first and last name, birth date, sex, phone number, street address, and you'll want to include zip code, apartment, unit number, city, and state. We may need to contact that participant, so it's very important that we have that phone number. And it's also very important the address is correct so that we can mail the result to the participant to share with our healthcare provider. The screener will record the results on line S on the participant form. Once the Pap smear is completed, you will place the form into the pocket. Make sure that the name is on the outside, and there'll be a second pocket which you will place the specimen cup, and you must turn it tightly past the black line to make sure there's no leakage. You will close this up. You will also make sure that the name has not been abbreviated and it matches the form, as well as the date of birth. These two must match. You will place the completed specimen in the box provided by 9 Health Fair with a liner, and you will label it Pap smears and your site name. You will then take this completed box after your fair is done to the laboratory area, and Quest Diagnostics will return these Pap smears. Unused supplies may be returned to the lab area as well, and Quest Diagnostics will get those back to 9 Health Fair to repackage and send out to another fair the next day. You will want to have a screening schedule guideline, and there are several examples in the resource guide, or you can have your own. You want to make sure that the screener has enough time to screen all the participants. You may have to close the screening early if the screener does not have enough time to perform the Pap smears for those waiting in the waiting area. You will have a tally sheet that the screener needs to complete, and this will be sent back to the 9 Health Fair. The female attendant who is accompanying the screener for every Pap smear can help determine the time frame and how many more Pap smears can be completed. If a lubricant is needed, it must be a non-petroleum based lubricant such as KY or a generic equivalent. If the participant has further questions, you can send them to Ask a Medical Question, Get a Referral. You may also call the 9 Health Fair with any questions to reach a nurse or healthcare professional, 303-698-4455. Again, thank you for volunteering for 9 Health Fair.